Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient which you had requested. The area of interest is the upper right 4, upper right 5, and upper right 6. Here you can clearly see we've got an upper right second premolar which is missing, and the upper right deciduous second molar is present here. The second molar has a distal cavity as well. Taking you to the sagittal view here, you can see that the 4, the 5 is missing. Then we've got an E, and we've got an upper right 6. The upper right 6 has a slight bit of a radio opacity here. On the transaxial view, which is basically the proximal view, we can see the upper right 4 has 2 canals and 2 roots present. We don't see any cracks, or we don't see any major cavities. Moving to the upper right 5 region, here we can see this is the deciduous molar. Both the roots basically has 3 roots present: the parietal, the mesiobuccal, and the distobuccal. This is very favorable for implant placement. We've got approximately 9.4 mm of ridge width in the center, and approximately 8.5 or 8.2 millimeters of ridge height. A little bit of a sinus lift might be needed so that an adequate height can be placed, but a shorter and a fatter implant can also be placed here. Moving to the upper right first molar, the upper right first molar has 2 canals: the mesiobuccal 1, the mesiobuccal 2, MB1 and MB2. Very slight pedial widening, no periapical radiolucencies can be observed. This is the parietal canal, the parietal root, and then we have the distobuccal root as well. Also, something noteworthy is that there is a maxillary mucus cyst present in the upper right quadrant, which should be something that needs to be kept in mind if a sinus lift procedure is planned. On the axial view, you can see that these are the 3 roots on the axial view: mesiobuccal, distobuccal, and parietal. We've got adequate bone in the interradicular area, and all the 3 roots are very adequately spaced out. Here you can also see that we've got very narrow canal configuration of the 6, but we've got 2 canals, MB1, MB2, a distobuccal, and a parietal. No cracks can be seen, and this is where the cyst is present right above the region of the 5, but it is relatively far away from the area where the sinus lift needs to be done. It's not in direct communication. Thank you very much.